And you're listening to Viewpoint on WDOE, and today we have representatives from Brooks Memorial Hospital. We have Barb Pietro, and she's the charge nurse at Brooks Memorial Hospital's GI lab. Barb, welcome to the program.
Thank you very much.
And also Desiree Coon, and Desiree is the Director of Marketing and Community Relations at the hospital. Welcome to the show.
Welcome, Dave.
Well, we're the focus today, and we're kind of continuing the discussion on colorectal cancer awareness. And you have a special HealthQuest program that's coming up on the 14th, and tell us a little bit about it.
Yes, Dr. Pietro has agreed to be our presenter on the 14th, and he'll be doing a program on colorectal cancer awareness, presenting a lot of information about the procedure, the prep, the indications when you should have it. So it's going to be a great program at the Elks Club, 7 o'clock on March 14th.
Now, Barb, tell us a little bit about yourself and your involvement.
Okay, well, I've been a registered nurse at Brooks Hospital for a total of 31 years. 28 years of those have been in surgery and in the GI lab.
Now, Barb, why is the topic of colorectal cancer so important to you? Because you have been, your family has been touched by this.
Well, my father died of colorectal cancer before I took over the GI lab. He would have had a much better outcome with his disease had he had early screening. Early detection with screening with colonoscopies makes a big difference in your outcome, and it would have made a big difference in his outcome.
Now, tell us a little bit about the GI lab at Brooks.
Well, Shirley, Tara, and myself are designated staff in the GI lab where the procedure is performed. We assist Dr. Joseph Askar and Dr. Haider Alam in your colonoscopy. So when you come to the GI lab, you most often will see us, plus nurses from surgery who do come and help us in the room. We do have HD technology now, so you're getting the best colonoscopy that technology can offer now. So that's pretty good.
Is that deal with the screen, they're viewing
Yeah, the
as they do
scopes
this?
themselves have the technology as well as our monitors and all that.
Okay, so that's really very important as you are doing this. Now, preparation is also a key to the success.
Preparation is the most important part of having your scope done. Your doctor will order a diet change, usually clear liquids, a certain time before you start your colon cleansing prep, which he will order for you. Different preps are for different people.
Oh, really?
They order that. It's very, very important that you follow those instructions. It's very important because we can't see your colon if it's not clean. So it is probably the most important part. And so once you've done that, you've done everything you have to do, and we'll take care of everything else.
Do you have to turn people back if they have not,
Well,
for whatever
it depends.
reason?
It depends on how much of the prep they have done, how thorough we think it is, and the doctor determines whether he thinks he can get a good look or not.
So you have to have kind of a consultation right before the procedure.
Yeah, exactly. People go to a prep room where Cindy is there, and she'll ask them those type of questions. If they took all their prep, and then she'll get them all ready before they come to our room.
And they check them out, make sure they're healthy to go through.
Exactly, yeah. You have all that
procedure.
pre-op stuff.
Now, what can a patient expect from the actual colonoscopy?
Well, when you're scheduled with your physician and you do your prep at home, obviously, then you're going to come 30 to 45 minutes before the procedure. You're going to come to Cindy's room where she's going to get you prepared. Do all the paperwork, which we have, we have paperwork, but also to ask you about your prep, to start your IV, to just get you all ready out of bed. And then I will come and get you, and then I take you to the lab where we will do the procedure. During the procedure, we do give a type of IV sedation, so you have to have a ride home. You cannot have IV sedation and drive home after the procedure. That's really, really important. And then after your procedure, we take you to the recovery room where the recovery nurses will recover you for at least a half an hour, and then you'll go back to Cindy's room and she'll get you ready to go home.
Now, do you remember any of this if you've gone through the procedure?
Some people do remember. If you're comfortable, we're happy, and that's what we strive for.
That's the key. Now, tell us a little bit about what Dr. Alam, what he will be covering during the HealthQuest program. Desi?
Dr. Lom's going to provide some information on the prep. He's got a little video piece he's going to show the importance of the prep and the actual procedure itself. It's very informative. Then he's going to be talking about who needs to be screened, when they need to be screened, some follow-up options and things like that. So.
And it does depend on the individual, right? Their family history, that
Yes.
sort of thing.
Yes, if you have a family history, then your doctor is going to want you to go in sooner for your colonoscopy, your first one, and also more frequently after that, depending on what they may find.
Why don't we talk a little bit about health insurance coverage when it comes to colonoscopies, and what happens if someone doesn't have coverage? Are there services available for them?
We're very lucky here in Chautauqua County. The Chautauqua County Health Network works with the Cancer Services Program of New York. They administer that, and they have a program that will provide free breast mammograms as well as free colonoscopies and follow-up. They have guidelines which they'll be able to tell you about whether your insurance has a high deductible or you don't have any insurance. But there'll be information about that at the program as well. But Chautauqua County is lucky to have a program like this.
Is there a number they can call if they'd like more information about that?
Yeah, the Cancer Services Program for Chautauqua County, the number is 1-800-506-9185. We'll have brochures and information pamphlets at the program on Wednesday the 14th as well.